Welcome back after the break. You're tuned into the Community Hour, and in the studio we have got Susan, Kashmir, Suresh and Ola, who are here talking about TB. Susan, were you going to tell us a bit more about some of the other symptoms?
Yeah, obviously TB is a TB bacteria which can involve any organ of the body. So you may get coughing, you may have a chest infection, 2 or 3 episodes of a chest infection, you may get coughing up of blood if you've got TB in the lungs, and that's called pulmonary TB. But you can get TB all over the body. You may get a swollen gland, which can be filled with pus, which can be TB. So you would not get the coughing symptoms from that. You can get, if you have any other strange symptoms, pains that won't go away, any swellings, then you really should speak to your GP, and that could be investigated. And one of the investigations would be for TB.
Okay, so what are some of the things that stop people from actually getting treatment?
Basically, what we find where we are based at the moment is the legal status. A lot of people that have come into the country don't know who to go to, not registered with a GP, can't speak English, can't get to places, like don't have money to catch the bus, get to the services, get to the centres, get to clinics, or can't speak their languages. They feel afraid, they feel shy that their family members will find out if they've got TB, which stops people from coming forward. Quite a few people will say to us, well, would you not let so-and-so of my family team know that I've got TB? There's a lot of things that stop people, but once we know that somebody has got TB, they normally end up becoming our friends. We get so close to them because normally they are on treatment for about 6 months. So, you know, sometimes some of our patients are really unwell when we first have them, and when they've had their treatment and they're cured, they're different people.
Yeah.
So basically it is, you know, we're out there for everybody who needs help. Just give us a call. We will leave our number at the end of the show. The best thing is, if ever you've got a problem, is go to your GP. That's what they're there for. They should direct you in the right direction.
So you said the treatment lasts about 6 months. How does the treatment work?
The TB treatment is 4 different antibiotics, so it works exactly the same as you would have normal antibiotics. Unfortunately, treatment takes 6 months, and for that period of time, for the first 2 months, you would get 4 antibiotics. Then after 2 months, we will reduce that down to 2 months. During this time, they see the TB nurses and the consultants on a very regular basis. We monitor them, we make sure their weight's increasing, we obviously count their tablets, make sure they're taking the right tablets at the right time, because there's quite a lot of tablets to take.
Yeah.
Some people can take up to 16, 17 tablets a day.
Oh, that's quite a lot.
It is a lot, but they manage. We try and persuade them that it's in their best interest to take their medicines.
And how much does the TB treatment cost?
It's actually completely free.
Okay.
It doesn't matter whether you're a visitor to this country, so you're just on a visitor's visa, you're not registered with a GP, you don't have recourse to public funds, you have no fixed abode, like you're homeless or something like that. It really doesn't matter. The TB treatment is completely free. So the diagnosis, the treatment is all free. And the reason is, we want people to come forward. If someone feels they've got the symptoms, you know, if they've been coughing for 3 weeks or more, don't delay, because one of the biggest things is that people take a long time before they decide to come forward. Like Kashmir was saying, there's so many different barriers that could stop people. But at the end of the day, if they don't come forward, they're going to get worse and worse. So they won't be well. They won't be able to look after themselves or their family. They themselves, may go to lose a job because they've let it go so long, because they're too unwell to work.
Yeah.
There's no need. The longer it goes on, the more likely they are to infect people close to them. And also, it just means that it might take longer with the treatment. So really, if anyone feels they've got any of the symptoms, they don't have to have all. They might even just have 1 or 2. But, if you've got a couple of symptoms, it just means something's not right. So why not go and check with the GP anyway, and make sure that you're well. But the fact is, it is completely free treatment, and TB is curable. So we just want to make sure that people are aware of that.
Okay, that's really good, because some people might just think, oh, they've got a cough and it might go away after a few weeks, but it is important to go to the GP, isn't it?
Yeah, I mean, that's the main thing. Like Susan said as well, if you've got a persistent pain or anything that doesn't seem to be going, or you just think, why am I so tired, or I'm not on a diet, I'm losing weight, and I'm really not feeling well, obviously that means something is wrong. It may not be TB, But whatever it is, you still want to get well from it. So, the aim is to get treated as quickly as possible.
Okay, and we've got another text in. It's from Sheila from Seven Kings. She says, if someone has TB once in their life, can it reappear again at any time?
You can get TB again, especially if you're not compliant with your medicines. In other words, that you don't take your medicines every day. Every day for the length of treatment that you are allocated. You won't get the same TB, but you can get reinfected by somebody else with TB.
Is there anything people can do to, help keep healthy and prevent this?
Yes, keep your body resistance up, do light exercise, have healthy, balanced diet, and no matter, even in winter time, let some fresh air into your house or wherever you are living, because otherwise the air gets stale, and whosoever has been there maybe has infected the air. So simple things like keeping the body resistance up. That means having healthy diet, balanced diet, no matter what age you are.
Okay.
I'd just like to add to that. Cover your nose and mouth when sneezing, because TB is airborne.
And coughing.
And coughing. It's not sneezing and coughing, exactly.
Yeah.
Yes. So although we hate spitting, it's not a nice habit at all. You can't get it from spitting, but obviously you can get it from airborne bacteria, which includes coughing and sneezing. So just as a matter of caution, cover your mouth and nose when coughing or sneezing. And if you are given TB medication, make sure you take it every day, like Susan said, and complete the full dose like you would any antibiotics for it to be effective.
Okay, and do you have any last words or advice for our listeners, as well as your contact details?
I will give the contact details now. So there are two different numbers. Obviously, the main thing is go and see your GP. Some people don't get symptoms at all, but if you're feeling unwell, then obviously go and see your GP. So the main thing is if you're feeling unwell or you feel you're coughing for more than 3 weeks, coughing blood, have no appetite, you're losing weight, you have high temperature, night sweats, or you're always tired, or you just feel generally unwell, go and see your GP. We also have in Redbridge the TB team, who also have language line for people who may not be able to speak English. Their number is 0208 970 8123. That's 0208 970 8123. If you're a group or a school or a place of faith, or a group of friends, 10 or more people in Redbridge, we will come with our health buddies and do a TB awareness session, especially for your group. To arrange a TB awareness session, please call us on 0208 514 9617. Okay, so if you'd like us to do a TB awareness session for you, it's 0208 514 9617. I'll pass the mic to somebody else because there may be some other last words that other people want to give.
Okay.
Just like to say thank you for having us and everybody listening to us. If you do need to speak to us, you can always contact us on the number that my friend Ola told you on 0208 970 8123. My number is 0208 970 8433. We can help you with any questions you may have. Again, if you don't want to come online, you can always speak to us via email. Always ring us up in the office and we're happy to speak to you. I'm going to pass you over to Susan. She will answer any more questions if anybody has any more questions. I can speak a few languages. I can speak in Hindi, Punjabi, Urdu, which is a great help. And also I would like to say that sometimes some of our patients do not have any symptoms at all. And sometimes if somebody's had TB in the family, you've been looking after them, and maybe 10 years ago or 15 years ago, or even some, if they're not with you no more, you've heard somebody in the family talking about somebody having TB in your family, always go back and tell your GP that, we did come across TB in our family. Then it opens a lot of other doors for the doctors to do different type of tests. But you really need to speak to your GP, or you can speak to us at any time. Thank you for having us. Kashmir Bajwa.
What I was just going to say was that if we have a patient that is diagnosed with TB, then we will offer screening to all the family members, and close contacts, so that we would check out all their friends and family to check to make sure that they don't have TB also. If a patient is currently working and is diagnosed with TB, then we would confidentially screen the workplace to make sure that it's not spread any further.
Okay.
So our work is not just based with patients. We will go out to various places and we visit patients in the home. We supervise their medicine in the home if they're not able to come out to the hospital on a regular basis. And we will give any advice over the phone. If you ring the number 0208 970 8123, if you've got any questions or queries, just please don't hesitate to ring us, and we would advise anybody that would want some confidential information or advice.
And you said a few languages are covered in Redbridge and Kashmir. You mentioned that you speak a few. Is there any other languages, just so our listeners can know?
No, I can also speak Hindi, Punjabi, and of course English.
Okay.
But also, our health buddies come from the different communities across the borough. We have people who can speak Gujarati, we have people who can speak French, we have people who can speak Arabic, we have people who can speak, one's Maltese, just different kinds of languages that represent our different communities. And we're always looking to get more, so we're also looking out for a Somali health buddy, somebody who can speak Somali. So if, again, either you want us to do a TB awareness session, or if you feel you would like to be a health buddy and maybe speak a language like Somali or an African language or any other languages that you may not have mentioned here today, please give us a call. Bangladeshi is another language that we're looking out for. Give us a call on 0208 514 9617. We really look forward to hearing from you. But the most important thing is, if you feel you have any of the symptoms or just don't feel well, or have had somebody with TB in the family, or been supporting somebody with TB, just get it checked out with the GP. Although you might say, well, I don't really want a screening of my friends and families. At the end of the day, do you want them to suffer? You don't want to suffer either, because it's curable. Why not get something done about
Everything's
it?
confidential as well, so
the
no one's
NHS
got anything to worry about.
Yeah, the NHS is confidential. They won't take your information out to where it's not needed. But at the end of the day, everybody just wants people to be well. In the old days when people got TB, that was it. You were gone. But now we know that it can be cured. So please take advantage of that, and remember the treatment is completely free. Thank you.
Okay, thank you, Susan, Kashmir, Suresh and Ola, for coming to New Sound Radio today. And it's great advice for all of our listeners, and it's good to know that it can be cured and it is free, and there is something that people can do about it. So thank you very much for coming in.
Thank you.
Thank you.
Thank you.